We're talking about one of the most important patient rights in the second episode of our Patients' Rights series, the right to voice concerns without retaliation and to be free from mistreatment. You're listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer, here with Jerry Finter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Because we know how busy life can get, Heartbeat is designed to give you helpful information in a bite-sized format.
This is a biggie.
Yes, it is, because a patient or a family member caregiver should have the right and the freedom to lodge a complaint if it's necessary.
They should feel comfortable and safe doing that.
Right. And I have to say, there have been times when I have known a caregiver to say, I was afraid to say anything because I was afraid it would come back to me. It would come back in a harmful way to me.
Yes, that it would affect the care.
Exactly.
I even had an elderly couple say that they had bad care with another agency, but they didn't want to make a complaint because they worried that if they did, their Medicare would be stopped, that they would lose their insurance. And of course, that's not true at all.
No.
But that was what they were concerned about. So basically, you become a patient or a family member, caregiver, becomes victimized.
Yeah, they become trapped in a situation that's not necessarily harmful, but it could be.
It could be. And at the very least, it's just lousy, right? If they feel like they're not getting great care. But at the worst, they are victimized, exploited, etc.
Right. Okay, so let's just be really clear. A patient or a caregiver has the right to make a complaint.
They have the right to be free from all forms of abuse. That includes verbal, mental, sexual abuse, or physical abuse, and to be free from mistreatment or neglect.
Right. So healthcare workers are mandated reporters of abuse, neglect, or exploitation. It's what we call A&E, abuse, neglect, exploitation.
Right. We are required reporters. And complaints can look a lot of different ways. They can take many different forms. It can be related to the quality of care, but also to how that care is provided.
Right. And it can be a complaint about something that could be considered minor, or it could be a complaint about something that's more major.
So let's talk about the types of things we typically see. I mean, and I realize there's a wide variety, but what are some of the things that people would have a complaint about?
Well, lack of communication. For instance, a family member may be struggling with when is this medication supposed to be taken, and when is the patient supposed to have a PRN medication, for instance, PRN meaning as needed. Right. So they're not sure, and so they need some help from the agency. So they make a phone call, and maybe it's after hours. So the on-call gets the information that the person had called, but then they don't call back.
Nobody calls back.
Right. And no visits made, no contact is made whatsoever. And the patient and the family are then left to wonder, what am I supposed to do? The patient needs some kind of medication, but I don't know what to do. And
when you think about it on the surface, it just looks like a phone call, a phone message that didn't get passed from one person to another. Okay. Right? We understand we're human. Systems fail. People lose things. Messages get dropped. People get busy. We understand that. But underneath that iceberg that you don't see is a family who is handicapped by a lack of response from the agency that they have placed their trust in, that they need to manage the patient's care. And if it's, say, for instance, like you're saying, a question about a medication that's needed for symptom management, have you left that patient in pain? Is the patient anxious? Are there symptoms that are an issue for the caregiver, delirium or agitation? So the caregiver's left in a bind. So something as simple as a dropped phone call is a huge thing. Communication with hospice teams to families and patients is just enormous.
Oh, it's incredibly important to be able to do that.
Absolutely.
So service failures, for instance, medication deliveries that don't happen on time.
That don't happen at all.
Or don't happen at all. Equipment that perhaps is not delivered in time, or the equipment that fails and there's no response from the agency.
Exactly. Or equipment that arrives at 11 o'clock at night.
Oh, my goodness.
So disruptive to the household. How about late visits, late in the day visits?
Okay, sometimes that can be a bad thing. What about an early morning visit when the patient's trying to sleep?
Well, when you have a patient that has poor sleep due to their disease process, so take a heart patient, a cardiac patient, or a respiratory patient, or even a dementia patient, and they don't sleep well, or they have trouble getting to sleep. There's insomnia, issues, sundown syndromes, things like that. They sleep later in the morning.
Right. Or how about this? A hospice provider who shows up without calling first.
So let's talk about that, Jerry Finter.
Okay, let's do.
I'm sorry. Let me pull out my soapbox for just a minute. So after the conclusion, the end of the care that we are providing for a hospice patient, hospice teams are going to survey that family to say, how was our care?
Okay, and what's one of the questions on that survey?
Oh my gosh. Did they call you to let you know they were coming to your home?
Mm-hmm,
Did they call you? Did they call you to say they were coming to your home?
Right.
It's simple. It's simple. I understand that when there is a critically ill, a seriously ill person in a home, that place becomes a place of visits, right? A lot of people coming in and out for whatever reason. But that doesn't mean there's not a schedule inside that house. They are trying to manage routines that seem familiar. They are trying to transition to other routines that are successful and help them cope and help them manage. It doesn't give healthcare providers carte blanche to just go in and out of that home whenever they please.
Right, exactly. So there should be a call to schedule a visit. Now, if the family has called and said, we have a problem, we need you to come out here now, they're expecting you to just come.
Right, at 1 a.m. or something like that.
Of course.
But otherwise, there should be calls. So that is a legitimate reason for making a complaint.
Right.
Absolutely. When you're planning your next event, keep in mind that the hosts of the Heart of Hospice podcast are available to speak at conferences and meetings. Whether you're meeting in person or virtually, we can provide education to your team on topics such as how to have compassionate conversations, how to recognize personal bias, building listening skills, and managing personal grief as a hospice professional. We'd love to encourage your team and remind them why the work they do is so important. Because we both have a personal hospice journey in addition to our years working in end-of-life care, we can also share a message of resilience and hope at your agency's next memorial service. To find out more, contact us at host@theheartofhospice.com. We'd love to be a part of your hospice journey. Now back to today's episode. Okay, so here's the last one that we want to bring up, an example of a complaint. Disrespectful communication from staff. We've talked a lot about communication, right? We know that's important. But disrespectful communication from your hospice team is never okay.
No, it's not. And actually, the patient and the caregiver are the ones who get to decide whether it was disrespectful or not.
Exactly. And sometimes people don't jive together very well. We have different styles of communication, different cultures, different attitudes, demeanors, etc. And some people just don't click.
Right. But it's up to the staff to be able to manage the communication and to understand the culture, the personality types, and so forth. It's not up to the family to try to fit into our little box.
Exactly.
It's up to us as providers to fit into their box.
Right. So that, again, is a legitimate reason to make a complaint.
Right.
Okay,
right.
So what to do? What to do if you have a complaint?
Right. What are the steps that you should take?
So first, you want to notify the case manager. The agency will have assigned a nurse, typically, or a social worker who is your case manager that sort of coordinates all your care and sort of the one-stop shop, in addition to the other disciplines that come out to see you. That's your first line.
Right.
That's your first person to talk to.
Okay, so hopefully after that communication, things should get better. What if they don't?
Well, you're going to take it up a notch. You're going to talk to the administrator or the director for the nurses, or the director of the agency, the owner of the agency. And if the person who is your primary person is the one you want to make the complaint about, you're going to start at that second step. You're going to go above that person.
So you talk to the case manager, that didn't solve things. So you go to the administrator or the owner of the agency, someone in the leadership of the agency, and that still doesn't resolve the issue. What do you do then? Is there something more that we could do?
Absolutely. A patient has the right to report to the state. There are state organizations in every state in the United States that are responsible for oversight of hospice and home care agencies. You can also talk to the accrediting organization for your agency.
Okay, so what's an accrediting organization?
Oh, it gets a little bit complicated. This is a federal thing. So an accrediting organization oversees the Medicare accreditation for a hospice agency. And not to get too technical, because that's not really helpful in this scenario, what a patient or caregiver would need to know is that your agency should, if they have an accrediting organization other than the state, should provide you with which organization that is. It's on your consent election form that you sign that says, yes, I want to go ahead and choose hospice care. It's also available publicly on the website for Hospice Compare.
Okay.
So that may be the fastest way to get into it. Hospice Compare, go into the website. It's run by CMS, the Center for Medicare and Medicaid Services. You can go in and you can actually search in your town for your agency. And you can find out who accredits them. And if they are not accredited by one of the accrediting organizations, your state is your best bet, your state organization.
Okay, so it's good to have that information. And you should have been given that information when you signed the consents.
Yes, agencies are required to give you that information.
Right. They should have given you a packet of material, and inside that is the information on how to contact the accrediting organizations, as well as how to contact the state if you need to contact the state agency.
Exactly.
So if you need to make a complaint, if there is a complaint, if there's a reason to make a complaint, you have the right to make that complaint, and you have a right to make a complaint without any retaliation or mistreatment if you do.
Thanks for listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer here with Jerry Finter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please take a minute to leave a rating or a review on Apple Podcasts.
Connecting with us is easy. All you need to do is send us an email to host@theheartofhospice.com. And you can also find us on all of the social media platforms. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.